with highs in the mid 60s and mid 70s tomorrow. We do have mostly dry conditions around for today and tomorrow, but some areas could see a few passing showers this evening. I'm meteorologist Peter Sherwood in the Weather Center.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones, and September is Sepsis Awareness Month. So today we are joined by Cape Fear Valley Health's Sepsis and Pneumonia Coordinator, Nurse Ashley Scott. We also have with us this morning the health system's sepsis program physician champion, Dr. Brian Crackover. And we also have one of the residents from Cape Fear Valley Health with us today, Dr. Paul Tenong. Now, we're also going to be joined during the second half of the broadcast with Ms. Eloise Garvin. She is the Seniors Health Insurance Information Program Coordinator for Cumberland County Council on Older Adults. And she's going to talk to us about the upcoming Medicare Open Enrollment Program. Now, before we get to our guest today, please remember that Making Rounds Live, this is for informational purposes only. This is not a time for you to self-diagnose. If you see yourself or maybe a family member or a loved one suffering from something that we may discuss today, what I want you to do is find yourself a healthcare professional. Also, I need to pass this along to you in case you haven't heard it on the news. Cape Fear Valley Health, they've updated its visitation policy due to an increase of COVID-19 cases. Now this applies to the Children's Emergency Department. And as of Friday, September 22nd, only one parent or guardian will be allowed in the waiting room with younger patients in the emergency department. Now, once the child is placed into the room, two parents or guardians can be with them then. But while you're sitting in the waiting room, only one, and this is due to the increase of COVID cases. Now, as you heard me mention at the beginning, September has been designated as Sepsis Awareness Month. And Sepsis Awareness Month, it kicked off in 2011. And this is where health organizations encourage everyone to learn more about ways to prevent sepsis. And in the United States, a person is diagnosed with sepsis every 20 seconds. Now, I'm going to let you think about that. Every 20 seconds. And according to the Sepsis Alliance, this adds up to 1.7 million people a year. Now, for those patients, rapid recognition and treatment are crucial to their survival. So, ladies and gentlemen, this is where we welcome Nurse Ashley Scott, Dr. Brian Crackover, and Dr. Paul Tenong to Cape Fear Valley's Making Rounds Live. Welcome, everyone. Thank you for being with us.
Glad to be here.
Now, Nurse Scott, we'll start with you. Explain what sepsis is and why it's so important to know about it.
Sepsis is your body's response to an infection. So you may not know that you have an infection, but your body has a dysregulated response to it, which can ultimately lead to organ failure, shock, and death. So it's very important to find the source of your infection so that they can start appropriate antibiotics in order to control the source.
Dr. Crackover, a person's age or medical issues, are patients with these characteristics, are they more, can I talk today, please? Are they more susceptible to getting sepsis?
Absolutely, Omega. The scary thing about sepsis is that anyone can develop sepsis. However, we usually see it more frequently in older patients over the age of 65 or very young patients under the age of a year old. We also see it more frequently in people who are obese, people who have diabetes or chronic lung disease like emphysema or COPD. And there's a growing body of literature that shows that people who are on long-term opioid therapy for chronic pain also have a weakened immune system, but we're not entirely certain yet what role that plays in their susceptibility to sepsis. However, like Ashley spoke about, the sepsis cascade starts with an infection. And really anybody, whether it's from a strep throat, from a urinary tract infection, from a pneumonia, or from an infected wound, could potentially develop sepsis if that infection is not treated.
Dr. Tanong, how fast can a sepsis infection move, and what's the timeline?
Sure. It's a great question, Ms. Jones. So, with any type of ailment, the fastest you can address that pathology, the better the outcome is going to be for that patient. So, I mean, there's, as Dr. Crackover, there's a lot of literature out there. There was a governing body, a global body, Surviving Sepsis campaign that came out with certain parameters that you want to look for. So what they say is engaging antibiotics within an hour of sort of suspected diagnosis. But like I said, sometimes, we don't know. We kind of are our own troopers. I'm sort of guilty of this. Even though I am a physician at heart, I try to see if I can tough it out and see, this is going to be fine. I can withstand it. And sometimes, in those more higher risk populations, once again, as Dr. Crackover has discussed, you got to have a high index of suspicion, like, hey, this is not normal. I need to go see a healthcare provider to get this properly diagnosed and treated. But to answer your question, usually, as soon as possible would be the generalized answer, but usually within an hour, because these things can progress quickly.
Yeah. Nurse Ashley Scott, Dr. Brian Crackover, and Dr. Paul Tanong on Making Rounds Live this morning. If you have a question, what you can do is you can give us a call at WIDU at 910-483-6111. And you can leave the message with Miss Gloria at the front. She told me I could mention her name on the radio. And you can leave the question with her at the front. You don't have to go on the air if you don't want to. If you do, we would love to hear from you. Also, if you're following the broadcast on Cape Fear Valley's Facebook page, you can leave the question in the comments section, and Ms. Lindsay will make sure that we get those questions answered for you while we have the experts with us today. Also, I want you to share the broadcast. We're going to have some great information today. So instead of trying to be that messenger and you always leave something out, just share the broadcast and then they can see everything for themselves. Talking about sepsis this morning on Making Rounds Live, Nurse Scott, how do people get sepsis?
People get sepsis from some type of infection that they have in their body. You're not able to catch sepsis from someone else, but you very well could catch the infection that they have if it's a contagious one, but it's your body's own response to the infection, so you can't catch it from somebody else.
All right. And Dr. Crackover, what's usually the first symptoms that people need to notice or patients need to notice?
Well, any infection can cause sepsis. What's the difference? When people get strep throat or get an infected cut or get pneumonia, they'll start with localized symptoms. So pain at the site or swelling as a form of inflammation. What I always describe to people as your body, when it's working properly, responds locally to a local infection. Where you start to convert into sepsis is when that part of your body has to ask the rest of your body for help. So you'll develop a fever and you might be feeling shaking and chills. As your body starts to recruit more blood flow to fight that infection to that specific area, you might feel weak and dizzy or break out in a sweat because your blood pressure drops. You may notice more pain at a site, and we see more frequently in older people, instead of these more obvious symptoms, they'll get confused or disoriented. We call that delirium. Some people may get short of breath if a severe pneumonia impairs their ability to use oxygen. And very commonly, we'll see people's heart rate go up above around 100 beats per minute. As your body's, all of your immune system and cardiovascular system try to respond to that process, it'll increase blood flow through increasing heart rate. You might notice some swelling in a particular area of your body. All those things can cause symptoms, but they're very nonspecific.
Now, one thing that you, when you were just talking about the symptoms, Dr. Crackover, I do remember seeing those very same symptoms last year when my husband passed away. He had, for those of you that don't know, he had intestinal blockage. His intestines ended up having a heart attack. I didn't know that type of thing could happen. A portion of his intestine died, and he ended up getting septic. Those very same symptoms, I remembered seeing the delirium. I remember the fever. I remember everything that you said. So I'm just basically sharing this again in case, just so people will know that pay attention. Loved ones, pay attention to wives, pay attention to your husbands, pay attention to your wives, pay attention to your family members, especially this is with the rise of COVID and all of these other things that can go on. Just pay attention. All right, I'll get off my soapbox now. Dr. Tanang, let's talk about protocols at the hospital. When do sepsis protocols kick in with someone suspected of having sepsis?
Well, probably Nurse Scott might be able to tell us more about it, but
Okay.
I can answer that to the best of my ability. But a lot of times, these patients come in, they see Dr. Crackover first, and then you do your initial assessments. Like he says, you look at, you get vitals, you get all these things. And if they hit certain parameters, like the heart rate being too high, the respiratory rate being too high, a fever, certain lab studies that show that there's an infection brewing, that kind of hits certain things that kind of nurses do on their assessment, and then they alert us as the physicians or whoever the provider is that, hey, this patient meets sepsis protocols. Then obviously it gives us, we have to use more of a telescope. We have to pay attention to these patients because they're more sick, obviously. And then we sort of kind of go from there. But yeah, that's usually how it comes from us. My specialty is more in the surgical realm. So like I said, a lot of times, I get messaged after sort of the first battle has been done. But like I said, we pay close attention to these patients because if they're calling us, there is something that's acute and very serious.
Ashley, I'll ask you the question.
If you can't answer, that's
I
fine.
know he's already answered it, but since you're the one that would know that would have the answer, so let me ask the question to you as well.
Very correct. There are best practice alerts built into our medical system that will notify the nurse or whoever's taking care of the patient that the patient is meeting sepsis criteria with recent lab results and recent vital signs, so that then will prompt them to alert the physician, whoever's taking care of them, and to initiate the nurse-driven protocol. And from there, labs are ordered to further diagnose.
Now, is there a test or do the healthcare providers mostly have to rule things out?
Well, both.
Okay.
In sepsis, there's a set of physiologic parameters: elevated heart rate, temperature, and a source of infection. Also, things like an elevated white blood cell count can give you an idea that there's a severe infection going on. Where there's some controversy is there one lab test that says sepsis, yes or no? And there really isn't. A lot of times we'll use an elevated lactic acid level in a patient's bloodstream to suggest that certain organ systems might not be getting enough blood flow, but you can certainly have sepsis with a normal lactate. you can also have elevated lactate levels without sepsis. And so it really does rely on looking at the whole patient, understanding from a patient's family that they're not acting the way they normally do, or that there definitely has been a change, when that change occurred, or really, again, looking at the whole patient, not just one lab test.
We're talking about sepsis with Nurse Ashley Scott, Dr. Brian Crackover, and Dr. Paul Tanong on Making Rounds Live. Nurse Scott, what if a person is at home and they're worried if they have developed sepsis? What should they do?
If you're at home and you think you or a loved one has developed sepsis, you should seek medical treatment immediately. I've kind of beat this over the head, that source control is so important. So early goal-directed therapy is very important with treating sepsis. So finding the source of your infection and getting antibiotics on board and treating any symptoms is best for survival.
Dr. Crackover, let's talk about treatment. Once a person knows or suspects that they have sepsis, could you tell our listeners what the treatment looks like?
So early recognition is absolutely the key, and some of those key signs like feeling weak and dizzy, having a fever, a rapid heart rate, localized pain, or things like that can certainly drive treatment. But overarchingly, the cornerstones are antibiotics, fluids, and organ support. What does that mean if you have pneumonia or severe COVID and your lungs aren't able to transport oxygen well? Then we give you additional oxygen. If your blood pressure is real low, then we can start with IV fluids, and if those don't work, there's medications we can use called vasopressors that can raise blood pressure. If there are additional sources of infection, like people, say, with diabetes who can get severe foot infections, or people with what we call ischemic bowel or intestines or another part of their body is not getting blood flow, and those tissues start to die, you have to surgically remove them to remove the source. But the overall cornerstones are antibiotics, fluids, additional oxygen if needed, and treating the underlying source. The problem with sepsis is once you get to that point, it's beyond an infection, and that we're now starting to deal with your body's dysregulated inflammatory response. So taking away the infection doesn't necessarily stop the sepsis from happening, but it certainly is not going to stop without it, if that makes sense.
That makes a lot of sense. Dr. Tanong, where's the dividing line between catching sepsis on time and catching sepsis later?
Yeah, that's a tough question, and we sort of been hitting the same theme with both of my colleagues here about you want to get it as soon as possible, but I think that line is when you start having signs of other organ damage, as he was talking about. Your liver enzymes start going up, your kidneys are showing signs of injury, your heart's not working as well as it should. But I think I look more at the hemodynamics, and what that means is vital signs and primarily heart rate and blood pressure. So when your heart, obviously if you're not keeping up enough perfusion to your organs, as we discussed earlier, you increase your heart works harder so it can pump out more blood and more oxygen to go and address your organs. And then also too, your blood pressure is kind of falling down, so you're not getting enough of that volume to those areas. So that's when I start seeing that, when I'm looking at a patient's chart or in my room, I'll look at the vital signs. I want to see what's going on. Obviously, everything that Dr. Crackover and Ms. Scott talked about before with just looking at them clinically. But yeah, when I'm starting to see their heart rate jump really high and their blood pressure is coming down low and it's not responding sort of to those first, adjunctive measures like giving fluids, and now you're starting to use those vasopressors as you discussed, then I'm becoming more concerned. And that's getting towards the later aspect of catching sepsis.
If it's caught early or if it's caught on time, is sepsis fatal?
No, I mean, that's the beauty of medicine, especially in our time period. We've made some amazing advances in technology with labs and everything, and of course our protocols. We've grown and we've evolved. Not to say that it still can't be fatal. But I think if you catch it soon enough, we have a much better prognosis for that patient than obviously being later.
In the middle of an interesting conversation and discussion about sepsis with Nurse Scott, Dr. Crackover, and Dr. Tanong on Making Rounds Live this morning, Nurse Scott, is sepsis more or less common than, let's say, 20 years ago? And is it something that we're seeing more frequently over time?
Kind of to piggyback on what Dr. Tanong just said, with the evolution of medicine, Sir William Osler was one of the first ones to ever really say anything about sepsis back in the 1900s, saying that it's usually the body's response to the infection that they die from and not the actual infection. So just knowing that we can treat whatever the infection is, treat with fluids, just knowing all of that, I think that the research has been more prominent and the cases may be more out there just because we're learning more about it. But I don't think it's been more common now than it was 20 years ago. Yeah. I think it's just more awareness of it now, more research and more studies has been going on for the community to know about it.
Dr. Crackover, I think with COVID-19, when the pandemic, it made us more conscious of hygiene, or hygiene conscious rather. Is there anything that a person can do personally to prevent themselves from getting sepsis?
That's a great question, and I think absolutely yes, there are. We did, speaking as an emergency physician, in addition to seeing more COVID cases early on, we did see a pretty significant decrease in things like gastrointestinal illnesses and other colds during the COVID pandemic because people were so hygiene aware, because people were wearing masks. And as the mask precautions and a lot of the COVID concern went away, we started to see a lot of those things come back. And so hygiene absolutely makes an impact. Not just personal hygiene, but keeping your home clean, keeping surfaces clean, as well as keeping yourself healthy. The best way to prevent illness is not to get it in the first place, but keeping your diabetes under control, keeping a lot of these chronic medical conditions from getting to the point where they really do impair your immune system. But the challenging thing about sepsis is it's really difficult to predict from the pre-sepsis state when an infection is going to become when an infection is going to progress to sepsis. There's not really a good lab test. There's not really a good set of predictive analytics. I know we've switched over to an electronic medical record system several years ago that's enabled us to do a lot more sophisticated data analysis, but we have really not been able to find a not sick, sort of a lab parameter in a not sick person that'll tell us that they'll develop sepsis. And so by the time they develop the elevated heart rate and the fever, those start developing kind of a systemic inflammatory response syndrome that is a precursor to it. But really the best things you can do is keep yourself clean, keep yourself healthy, keep your home clean, and practice just those good everyday habits that keep people from getting sick in the first place are the most effective ways to prevent you from getting sepsis.
What if you're a patient in the hospital?
So pay attention, because as many people are aware, hospitals are becoming busier and busier places. And the first thing that you can do if you're in the hospital is, and repeat after me, say, I am concerned about sepsis.
I am concerned about sepsis.
If your loved one has been admitted for an infection and you notice a heart rate going up on their monitor, even if it's for a period of time, bring that to the nurse or the physician's attention. Let them know. We can't be there in the room all the time with the patient, so we have monitors on all the time. But noticing those small perceptible changes in people's behavior, noticing changes from the normal. Mm-hmm. If you're a patient yourself or if you're there visiting a loved one, all of those things are important. And they may not necessarily need a response immediately, but the sooner we know about them as physicians and nurses, the sooner we can just keep that in the forefront of our mind that, hey, we need to look at this patient a little bit more frequently, a little bit more closely, and just be more aware. Making sure that all of the procedures and policies that we have in place, again, this is more for us, not so much on the patient side, but following the protocols, following our isolation precautions, making sure people are hand gelling in and out of rooms, and really just following those good basic practices that prevent infections, also prevent sepsis.
All right. Roundtable wrap up, and this is for all of you. What is the one thing that you want our listeners to take away from this conversation this morning? And Nurse Ashley, we'll start with you.
Well, like Dr. Crackover said, in the hospital, if you have an infection or family member is there, just suspecting sepsis if you see a change with them. And also, as we've talked about the cascade, I like to say time is tissue, so getting treatment as soon as possible to prevent mortality.
Yeah, I'm just going to keep it simple. Be smart. Recognize, when things are kind of different than the usual. And then there's nothing wrong with reaching out to your PCP, your primary care doc, or asking somebody else for help. So.
And Dr. Krakow.
I'm going to make a plug for some of our more vulnerable populations. We have a lot of people in our community who are older, they have disabilities, live by themselves, or maybe a little bit less connected to others. Check on them. Send them a text message. Say, how are you feeling? How are you doing? Just establish that daily awareness so that when somebody does get sick, you're aware of it, and we're not finally getting to see them 3 days after they've been sitting at home by themselves with a urinary tract infection, or these very non-specific symptoms that have been going on for several days are now getting worse. It's a lot easier for us to prevent sepsis by treating infections early before they develop into those systemic symptoms than waiting until after things have already started. And so paying attention, staying connected with your neighbors and your family members and loved ones, and just being aware. If there is one real plug, is pay attention to each other and be aware, and that helps us identify it as soon as possible.
Well, thank you so much. Ladies and gentlemen, Cape Fear Valley resident Dr. Paul Tenong, Cape Fear Valley's Sepsis and Pneumonia Coordinator, Nurse Ashley Scott, and we had with us today the Health System's Sepsis Program Physician Champion, Dr. Brian Crackover. Thank you all for taking time out of your busy schedules to be with us today to share this information. Thank you so much. Now, if you have any questions about Medicare open enrollment, get them ready, because up next is Miss Eloise Garvin, and she's going to answer those questions for you on Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The We Do Radio Network.
On Monday, Governor Roy Cooper announced that Medicaid expansion will begin on December 1st. North Carolina Department of Health and Human Services Secretary Cody Kinsley says the expansion will help residents in rural areas along with better mental health assistance for veterans. Hunter Biden sued Rudy Giuliani and his former attorney today, claiming they hacked and manipulated data on an external hard drive associated with his laptop. In Britain, 5 people accused of being part of a Russian spy ring have appeared in court. They've been linked to Jan Marsalek, the former Wirecard executive who vanished 3 years ago after that German firm's $2 billion collapse. A precautionary advisory has been issued for portions of the Cape Hatteras National Seashore after recent beach erosion likely exposed petroleum-contaminated soil at the old Coast Guard station. The department asks anyone who notices any plumes, sheens, or fish kills in the area to avoid coming in contact with those waters. Mike Rayleigh, NCN News.
At SCCU, we work for our members, not shareholders. And we've got values, like supporting your financial well-being and helping you achieve your goals. Since 1937, we've strived to exceed your expectations with relationships you rely on, financial products for every stage of your life, and the resources and technology that you expect. Because together, we are SCCU. Learn more at wearesccu.org.
WIDU News, I'm Julio Flores. 3 decades after Fayetteville formally became a sister city with Saint-Avold, France, the relationship is still going strong. A delegation from Saint-Avold is visiting Fayetteville this week, and on Monday, as a symbol of the relationship's endurance, Mayor Mitch Colvin presented his Saint-Avold counterpart, Renee Steiner, with a key to the city at the Fayetteville City Council meeting. Colvin said the key is the highest award Fayetteville can offer. Speaking in French, Steiner accepted the token, noting he is proud of the relationship between the two cities and all they've accomplished together over the decades. A translator helped get his message to the audience and council. The Spring Lake Board of Aldermen were introduced to the town's new interim finance officer, an appointee of the state employed to help the town regain its fiscal footing after a large embezzlement was discovered in 2021. And also voted to dispose of 14 town vehicles Monday night. Kendra Boyle was appointed finance officer on September 12th by the State Local Government Commission, which assumed control of Spring Lake's finances in October 2021. We do local news every weekday morning on WIDU.
Have you lost North Carolina Medicaid? At healthcare.gov, you can find a low-cost, quality health plan.
Do plans cover doctor visits?
What about emergency care?
And prescriptions?
All covered and more. Plus, with the new law, 4 out of 5 customers can find a plan for $10 or less per month with financial help. Healthcare.gov is here for you. Enroll today for coverage starting the 1st of next month. Paid for by the U.S. Department of Health and Human Services.
We're going to see temperatures today in the upper 60s and the lower 80s. Those cooler temperatures will take shape across our northern counties, and we are likely to see a mix of sun and clouds for the afternoon as well. Come tonight, we're down into the mid-50s and lower 60s, with highs in the mid-60s and mid-70s tomorrow. We do have mostly dry conditions around for today and tomorrow, but some areas could see a few passing showers this evening. I'm meteorologist Peter Sherwood in the Weather Center.
PwC wants you to know, if our sewer lines get blocked, wastewater can back up and overflow into the environment, harm our clean water supply, and even damage your property. But there are things you can do to avoid wastewater backup, like cease the grease.
And keep wipes out of pipes.
Pouring grease, fat, and oil down the drain is a major cause of sewer line backup. To cease the grease, let used cooking oil cool down. Pour it into a disposable container and put it in the trash. PwC offers free fat trappers you can use for disposal.
Hand or baby wipes, even if they're labeled flushable, should not be flushed. Please, keep wipes out of our pipes. That goes for other items too, like paper towels, diapers, feminine hygiene products, kitty litter, and more.
To learn more about fat trappers and ways you can conserve and protect our environment, visit FAYPWC.com.
Hello, this is Reverend Dr. Patania L. Island, pastor of Hood Memorial AME Zion Church, and I am inviting you to come out and join us every Sunday morning at 9:30 for our Sunday school, and at 11 o'clock our morning worship service. We have midweek service on Wednesday nights at 7 o'clock p.m., and every first Friday night is our Shabbat praise night at 7 o'clock p.m. Hood is on fire for the Lord. Don't you want to join us? Where no one in the kingdom got swagger like us.
Bryan Honda presents the 2023 WIDU Anniversary Celebration, Friday, October 27th, 6:30 p.m. at Kingdom Impact Global Ministries, Fayetteville, North Carolina. Traditional gospel night featuring Doc McKenzie and the highlights. Lisa Knowles and the Brown Singers. And Stellar Award winner Zacardi Cortez. It's a night full of praise and worship. Don't miss the McDuffies, the Virginia Airs, tickets. So let's celebrate together at the WIDU anniversary. Advance tickets on sale now. Available at WIDU and the usual ticket outlets. Friday, October 27th. Doors open at 5:30 p.m. The WIDU anniversary at Kingdom Impact, Fayetteville.
Are you hurting from back or neck pains? Struggling with weight issues, especially during the pandemic? Don't feel alone. Many of us experience these same challenges. Grace Creek Chiropractic and Wellness Center, Dr. Joy Smith-Jones is helping many people with much-needed relief care. Spinal correction utilizing gentle chiropractic techniques, teaching and coaching corrective exercises, lifestyle advice, nutritional counseling, spinal and postural screenings, and dry needling and cupping are some of many treatment options Dr. Joy offers at Grace Creek Chiropractic and Wellness Center. Conveniently located at 5106 Highway 87 east of Fayetteville, Grace Creek Chiropractic and Wellness Center is easy to find. Experience the positive and uplifting environment with Dr. Joy and her staff committed to help you feel better and enjoy life. Reach out to Dr. Joy Smith-Jones, Grace Creek Chiropractic and Wellness Center for the relief care you deserve today. Call 910-703-3386.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Now, before we introduce our next guest, I do need to let everyone know that every first and third Wednesday from 9 a.m. until noon, job seekers can walk into the Human Resources offices at Cape Fear Valley's main campus, Betsy Johnson Hospital, Bladen County Hospital, and Central Harnett Hospital. And their staff will tell you about help you find and apply for jobs that are open. Also, positions are open in various departments at all skill levels. And what you need to do is make sure you bring plenty of resumes, and please make sure you dress to impress. Now, you can find more information about all of this at Cape Fear Valley's website at capefearvalley.com, and then click on the Careers tab, and you'll see all of that information for you. Ladies and gentlemen, it's time to introduce our second guest as we talk about Medicare open enrollment. And this beautiful lady, please welcome the Seniors Health Insurance Information Program, also known as SHIP. She is the coordinator. Her name is Miss Eloise Garvin, and she's from Cumberland County Council on Older Adults. Miss Garvin, welcome to the broadcast.
Thank you so much for having me.
Miss Garvin, rather than me reading and telling everyone what SHIP is about, could you explain what SHIP is for our listeners who may not know?
Certainly. In 1986, the North Carolina Department of Insurance incorporated the SHIP, which stands for Senior Health Insurance Information Program, where it helps people to understand their Medicare. Medicare can be confusing. So we have SHIP coordinators throughout North Carolina counties and volunteers that will help Medicare beneficiaries understand their Medicare and what they're signing up for.
Mm-hmm. When is the next open enrollment period for Medicare?
Open enrollment will start October the 15th through December the 7th.
And who needs to act during this time?
Anyone that is on Medicare, caregivers, family members that need to know how to help mom to make that sound health decision. Those that's on Medicare, they're probably receiving a lot of information in the mail and just don't know where to go. But if they call the North Carolina Department of Insurance, they will connect you with a SHIP coordinator in the county in which they reside, where they can call and make an appointment to sit down and talk one-on-one so that they get an understanding of what they're signing up for.
We're having a conversation about Medicare open enrollment on Making Rounds Live. Now, if you have a question for Ms. Garvin, what you can do is give us a call at 910-483-6111. Again, 910-483-6111. And you can, if you're following us by way of the broadcast, the live stream, on Cape Fear Valley's Facebook page, you can leave the question in the comments section, and Lindsay will make sure that we get that question to Ms. Garvin for you. Also, share the broadcast. We're talking and we have some very interesting information about Medicare open enrollment. Instead of you trying to be that middleman, if you're like me, you always leave something out. So this way you can share the broadcast, they can watch the broadcast themselves, and you can just go on about your business. But Ms. Eloise Garvin from Cumberland County Council on Older Adults in the studio with us today. Ms. Garvin, if a person doesn't want to make any changes to their Medicare plan, do they need to do anything?
They don't have to. If they're content with what they have and they understand what they have, they don't have to do anything. But if they have a caregiver, the caregiver should want to know how and what health insurance mom or dad may have. If you're not sure, you make an appointment so we can sit down and talk with you to do a comparison to see if what you have is what you need.
What if a person does want to, what would you recommend they do?
Is to make an appointment.
To make an appointment.
So that they can sit down and talk with a SHIP volunteer that will take them through the process by doing a comparison. Not only do you have Medicare, you can have original Medicare, you can have Medicare Advantage plan. Medicare pays 80%. You're responsible for the other 20%. But not only do you have to have the health plan, you also have to have a prescription drug plan. So when you come in, we'll ask you to bring your Medicare card and a list of your medications so that we can set up a Medicare account for you, so that you get a better understanding of what it is that you have, because I don't know about you, but through the years I may forget. Or the doctor may put me on another medication and come to find out my plan does not take the new medication. There's a process that you have to go through, and we can help you with that. Social Security will not call you. If someone is calling you to ask you about your Medicare card or your health insurance, hang up. Then give us a call, because there's such a thing as Medicare fraud.
Yes, a big one.
And you have allowed that person to receive the information that they should not have.
Ms. Garvin, we're always seeing these commercials about Medicare Advantage. It's all confusing to me. I'm just going to go ahead and say it. Are Medicare and Medicare Advantage the same thing? And if they're not, what are the main differences between the two?
Medicare, like I said, it pays 80%. You're responsible for the other 20%. With your Medicare, your 20%, you could get a supplemental insurance, which will help with your 20%. Most doctors will take the Medicare plan. Your Medicare Advantage plan does cover vision, dental, and hearing.
Okay.
But the doctor, your doctor, has to be in the network. If the doctor is not in the network, you're coming out of your pocket. And that's okay, as long as you know how much you're coming out of your pocket with. Your Medicare Advantage plans, a lot of people sign up for those plans because they've heard the advertisement on TV and didn't realize the zip code. Not every plan is offered in every zip code. So when you come in to sit down to talk to us about a Medicare Advantage plan, we will do a comparison for you so that you get a better understanding what you're signing up for and if your doctor is in the network. And what happens if you have to have a referral to the doctor. It's your responsibility to make sure that that doctor or that specialist is in the network.
So, Miss Garvin, so the commercials can air in this area, but the benefits not be offered because of the zip code?
Free sounds good, but if it's not in your zip code, then what? If your doctor's not in the network, then what?
Ladies and gentlemen, SHIP coordinator, Miss Eloise Garvin, from the Cumberland County Council on Older Adults on Making Rounds Live. We're having an interesting conversation about Medicare this morning. Miss Garvin, can people switch back to Medicare or switch back to Medicare Advantage if they've tried one and didn't like it? Can they switch back?
During open enrollment.
Only during open
Open
enrollment?
enrollment for Medicare is October the 15th through December the 7th. Open enrollment for a Medicare Advantage plan is January through March 31st of the following year.
Okay, so basically they can switch back, but they just have to wait to the open enrollment period.
And they have, when they switch back, they have to look at their Medicare prescription drug plan as well.
Let's talk about misconceptions. What are some of the common ones you hear about Medicare?
To be honest with you, I don't hear, because most of the people that we talk to, they understand what it is that they're to know about their Medicare. But there are some people that refuse to look at their Medicare summary statement. That after you see the doctor, you'll receive a Medicare summary statement in the mail, and some people won't look at it, and next thing you know, they're getting a bill. So looking at your Medicare summary statement is very important, because there can be miscoding. They could charge you for seeing a doctor that you didn't see. And there's a process that you have to go through that we can help you with that.
Any changes this year or upcoming changes to Medicare or open enrollment that people need to be aware of, Ms. Garvin?
It's getting the word out that this open enrollment period, and we would love to sit down and talk with you or the caregiver so that they have a better understanding of what mom or dad does have. The misconception would be signing up for something that does not cover what you thought it would.
If someone listening right now, Ms. Garvin, and they're like, I want to talk to this lady right here, how will they reach you?
All they have to do is call the Council on Older Adults at area code 910-484-0111.
Okay.
And anyone that answers the phone, the information and referral specialist will direct that person to either a SHIP volunteer, which is housed there at the Council on Older Adults, and we will make sure that the SHIP council will get in touch with them to set up an appointment. We also can help people over the phone.
Okay. Ms. Garvin, before we close out today's broadcast, is there anything you would like people to know about Medicare, open enrollment, or SHIP that we may have forgotten to discuss? Any final thoughts?
I think we've covered everything, but the one thing that I would like to mention is we're always looking for SHIP volunteers.
Okay.
And you can become a SHIP volunteer through the North Carolina Department of Insurance, where you will go through a training process in the privacy of your home. However, we have to make sure that if you're wanting to become a volunteer, that you don't sell insurance.
Okay.
We are unbiased. We're not insurance agents. We have to be unbiased. We don't promote one health plan over another. We give you the information so that you can make a sound decision.
You're kind of like a Consumer Reports type thing.
We try to be.
All right, one more question. We just received this. Is Cumberland County Council free service? Is it a free service?
Cumberland County Council on Older Adults is a nonprofit agency.
Okay.
And we have different programs. That's why it gives us the opportunity. You may call and talk about Medicare. We hear what you're saying, but we also hear that you're not saying. And because of the other services that we provide, home delivered meals, in-home aid, senior companion program, telephone reassurance, and of course, Medicare.
Oh my goodness, we need to have you on to talk about the other services.
We're so glad to.
And it's all for free.
It's free. However, if you wanted to contribute something, we couldn't tell you how much or how often, but when you do, it helps us to help someone else.
That's amazing. Ladies and gentlemen, Miss Eloise Garvin. Miss Garvin, thank you so much for being on today's broadcast.
Thank you so much for inviting me to come and share this information with you.
And we hope you'll come back again.
I would love to.
All right, thank you. Now, before we go, everyone, I do want to tell you about a support group that meets at Cape Fear Valley Health. Is the Life After Stroke team. Like I said, they meet every third Wednesday of the month at 3 p.m. in the physical therapy gym inside of Cape Fear Valley's Rehabilitation Center. Now, if you want more information, reach out to Miss Megan Dornan. Remember, she was on the broadcast before. And you can call her at 910-615-7077. All right, let me try that again. 910-615-7077. There we go. Well, ladies and gentlemen, that's a wrap. Please join me in thanking our guest once again, Cape Fear Valley resident Dr. Paul Tenong, Cape Fear Valley's Sepsis and Pneumonia Coordinator, Nurse Ashley Scott, the Health System Sepsis Program Physician Champion, Dr. Brian Crackover, and of course, from Cumberland County Council on Older Adults and the Seniors Health Services Information Program Coordinator, Ms. Eloise Garvin. Now, our next broadcast, ladies and gentlemen, is Tuesday, October 9th. It's October, so you already know we're going to be talking about breast cancer. So make sure you make plans to join us. For our producers, Shaka Jordan and Ray Thomas, our social media coordinator, Miss Lindsay Graham, and the hard workers behind the scene, I'm Omega Jones. Thank you so much for listening to Cape Fear Valley Health's Making Rounds Live.